Welcome. My name is Dr. Mary Schroth, and I am the Chief Medical Officer at Cure SMA. This video is a part of a series designed to educate the child neurology community, including caregivers, providers, and advocates about spinal muscular atrophy, or SMA. This video is created by the Child Neurology Foundation in collaboration with Cure SMA. These sessions bring together a caregiver and a provider to have a candid conversation and provide their expert advice about SMA. In today's video, we will address the evolution of SMA treatments and phenotypes. Joining me are Dr. John Bransema, neuromuscular section head at the Children's Hospital of Philadelphia, and Dr. Al Friedman, a licensed counseling psychologist and dad to Jack, a young man living with SMA. Welcome, and thanks for joining me today.
Thank you very much, Mary. It's a great pleasure to be here and to talk SMA.
Thank you, Mary, and thank you, John, for including me in this discussion about how the world of SMA has changed over the years. John, the treatment landscape from a medical perspective has changed a lot over these past years. Can you help us understand how the landscape has changed in terms of treatment?
I think we're always trying to do better in medicine. And so even before we had targeted treatments for SMA, we continually strove to do better with all of the different management aspects to improve people's qualities of life. That would be things like supporting the muscle weakness with augmenters of function. We wanted to try to be proactive rather than reactive to things that we might expect to happen with the progression of weakness. And this includes things like contracture management, spine management, hip management, and also the respiratory care, trying to be anticipatory of people needing more respiratory support in the more severe forms, and optimizing nutrition and bone health, which is really critical to people having the best possible systemic health with this disorder. So we're lucky to have international care consensus guidelines to guide us that experts in SMA have put great effort putting together to have an agreed standard that people should try to maintain in terms of optimizing someone's medical care with SMA. But in 2016, a new world opened to us because we had our first targeted treatment with the approval of nusinersen for SMA. Where we could actually give back what the body's missing. And we now have 3 medication options for SMA. Nusinersen is a spinal fluid delivered medication that helps to give back SMN protein. We have risdiplam approved in 2020 in the United States, which is a oral small molecule replenisher of what's missing. So that would be swallowed each day or given by G-tube for those who can't swallow. And then we also have gene transfer therapy for SMA, but this is usually right now only for the youngest patients, those under 2 years of age in the United States. We're hopeful to be able to offer it to older people with SMA, but there's some more research work that needs to be done at the current time to be able to offer that. And so the point is that we used to have a clinic visit for SMA where we were trying to cope with loss with a family. What is harder? What can't you do that you used to be able to do? What are you finding more difficult? And trying to find creative ways to just make sure you still could do everything that you possibly could. Now, a clinic visit is about what's new. What can you actually do that you weren't able to do before because you're on treatment? And this is a totally different experience of care that has really shifted how the care team and the clinic vibe overall has felt for this disease. I'm wondering, from your perspective, Al, how you have noticed this as from the family perspective in terms of this change over the past while, especially with all of your work with other families living with SMA.
It's been a full and drastic change over these past few years. A whole new world for the families has opened up. Speaking from personal experience, I agree with you. Our clinic visits early on were mostly first for mom and dad to cope with the loss of what wouldn't be for our son, Jack, and then to manage the disease and to do everything we could together with our treatment team to improve the quality of his life in the absence of treatment. And now, all these years later, I'm so Jack is still here to benefit from one of the three treatments, and the treatment is helping him. For our families as a whole, I, as a psychologist, have worked with many of our families over many years. Um, the feeling in the room for our newly diagnosed families in our conference has moved from a place of fear and grief to a place of hope. Still, having a diagnosis of SMA is a complicated and traumatic experience for families, but there's so much more hope for what's possible rather than loss and focus on what won't be possible. So from the family perspective, it's a wonderful change, and the fact that there are three treatments is a wonderful problem for some families to figure out which would be most beneficial for the child. So it's an exciting time and a hopeful time for our family community.
We are so grateful to have these new treatment options available to us, but it depends a lot on where you are in your journey with the disease when you start getting access to this, what your experience is going to be. If you're somebody who has been genetically diagnosed before you even have a symptom of SMA, we might be able to treat you early enough that you may have very minimal symptoms at first or for a long period of time. Whereas if you've been living with weakness for a while, we may need to be more tempered in what we expect from the treatment, but we're still hopefully at least not losing things as quickly, but hopefully keeping things the same for longer periods of time. And in many people, we've noticed that there's been improvement from what they were experiencing previously, which is such a wonderful thing to be able to celebrate with families again, as I said earlier in the discussion. Can you speak a little bit about what you think a realistic treatment expectation is in these different contexts from a family perspective? Yeah.
Oh, as we all know, every child affected by SMA is different in terms of age, different in terms of severity, different in terms of the age of onset, different in terms of when the diagnosis happened and how. So there's no one size fits all in terms of setting expectations. I think for our families, it's important to listen to the experts like you, John, who see a lot of our kids and can place each child on that continuum in order to set proper expectations. As excited as I am personally that my son is receiving treatment, I wasn't under the illusion that he would jump out of his wheelchair and walk because of the treatment, given where he is at age 25 as a non-sitter and affected for so many years. But the small incremental but significant changes that we're seeing from treatment, my son is a little louder, he's got more energy, he's moving his fingers a little more, which helps him to drive his wheelchair more safely. There's more stamina, and he's a little more movement in his knees, his legs. He's asking to use his speaking valve and to be off his ventilator more often. These are very small but very significant changes that we are celebrating, all relative to the place we started. So that's my son's story, but every child is different, and a child, as you had said before, and in a previous video segment, who's screened at birth or before birth and treated early, can have very different and significant changes and a different level of expectation for the provider and for the parent. So each of us is different, and each of us needs to follow the lead of our experts to help us have realistic expectations for our child.
I think the major point I want to emphasize for families is that when you have a diagnosis of SMA, stay with an SMA care team, and we're going to do everything we can to make your life as full and functional and independent as possible. But in this world of hope, SMA still impacts people in a significant way, and we do sometimes still see challenges that we have to cope with families and with medical teams that are difficult in this new world of excitement and promise, but we also are celebrating so many wonderful things, and we don't think we're done. You know, that there's no cure for SMA yet, so there's still research ongoing to try and make things even better, even when you're already receiving one of the treatments that we have available now. So we will not rest until someone has as minimal symptomatology as possible living with this disease. And it's so exciting where we've come in such a relatively short period of time, but we're excited to take this journey together with our families.
You've made a good point, John. From a family perspective, I think it's important for us to be able to differentiate between treatment and a cure. And what we have now are 3 SMA treatments, but not necessarily a cure. And so many of our family members, many of our children still require follow-up care, regardless of the treatment, and ongoing contact and follow-up from our SMA care teams. I'm wondering, John, in terms of the treatment landscape, there are a number of ongoing clinical trials now. What do these clinical trials mean for the future for SMA treatment and a potential cure?
Yeah, I think now we're having some targeted treatments available. We're trying to see whether we can perhaps use them in combination to do even more effect in some people living with SMA. If it's not genetically targeted in terms of what's missing in the body, maybe we could give a boost to the muscle, give a boost to other systems in the body that are not functioning at their best, to make sure that symptoms are as minimized as possible. So we will continue to do research and try to improve the lives of people living with SMA as much as possible. And with that, I think I'll transition back to Nikki with the Child Neurology Foundation.
Thank you all so much for joining us today and sharing your expertise with the child neurology community. For more resources, check out CNF's website at childneurologyfoundation.org and Cure SMA's website at curesma.org. Together, we are all child neurology.